The shooting death of United Healthcare CEO Brian Thompson on December 4th has propelled forward a conversation about healthcare in the United States. But the high cost of healthcare is hardly breaking news. Today, I'm talking with Todd Nelson, Director of Partner Relationships at the Healthcare Financial Management Association. Todd, the murder of this health plan executive has unleashed a firestorm of social media posts, of news stories, of people talking about their personal issues with their health insurance. But we've been talking for years about the way we pay for healthcare in this country. What do you make of all this frustration?
For any patient that's ever received a denial in the mail after they've received treatment and they believe it was going to be paid, that is a shocking moment for them, because many times they're not sure how they're going to pay for that bill. And now they realize they owe that bill. And so, the reality is that is another pain that's caused for people. And, you may have moved past your medical issue, but now you have a financial issue. And to me, that's the key, is how do we work together to solve those financial issues once the medical issues are taken care of?
What do you think are some of the most common issues that people have when it comes to health plan coverage? And more importantly, what can they do when they run into these issues?
Yeah, some of the more common frustrations are just understanding what they're covered for. So, it's a big purchase, like many things, but understanding what they can be treated for, how it will be paid, what are the steps and processes that need to go through to get authorized for treatment. And then once you've been authorized, will payment be made? And some of the frustration is, I think, patients believe that when they go to their caregiver and they receive a test or a procedure, that all of that's been done, that it's ready and that it's going to be paid. And there's confusion there. So when they get an explanation of benefit later, and it shows that there isn't a payment or that the claim has been denied, that leads to a real confusion by the patient of, I don't understand. I thought I bought the coverage. I thought in many cases someone else authorized the treatment, so that's why I went and got the treatment in good faith. And so that's where it's that confusion and that misunderstanding. And I would say, when that happens, you receive that denial. First of all, I would contact the provider, whether that's your hospital or your physician's office, and let them know, hey, I got this denial in the mail, because they're also going to receive a denial notice as well. And ask them some questions about what this means and what kind of scenarios there are to work together to try to appeal that denial. Many times, the provider, whether it's a hospital or an individual practitioner, is already working to appeal that denial on your behalf. So they have knowledge of it. So you can work together to work with the insurance company, talk about the process, talk about why it was denied, and go through the appeal process and the resubmittal of information. Because sometimes the information that's received doesn't line up with the coverage that you may have. And in that case, working hand in hand with whomever provided the service and the insurance company will lead to a better, more collaborative approach.
In those instances where, and we both know this happens, in those instances where a patient finds themselves kind of stuck in the middle of their provider and their health plan, and they feel like nobody's helping them, and the provider's saying, call the health plan saying, no, you need to talk to your doctor. What is your best course of action there?
What I tell my family is go down every avenue possible to you, meaning contact both the insurance company, contact your provider, let the provider know that you've received a denial, that you're working with the insurance company. Would they be willing to put your account on hold while you work with the insurance company on it? Make sure that you are working with the insurance company and following up. And the reality is you can feel stuck in the middle. If you've got your provider, and many times health system is going to have a patient navigator that can help you with those types of things. They may have a care coordinator or someone like that, depending on the type of service that you had. So there are resources out there. There are also health insurance counselors that are part of every state program. Most of the times they work with seniors, but they're usually volunteers that are from the industry, both the provider part of the industry and the payer part of the industry, that work with your local or your statewide insurance commissioner. And they look at your explanation of benefits, and they can help you look at those appeals and try to get support for getting those overturned.
Definitely no shortage of frustrations in the healthcare industry, but also a lot of resources out there too. Hi-Fi aims to be one of those resources. So we will be here talking about this more and more as time goes on. So thanks for watching.